So Liam, this comes up all the time. What happens when somebody pushes their button? I mean, how do you notify the care managers and service coordinators?
Absolutely. So what it looks like in real time, right? When someone presses their button, if it's a emergency, a non-emergency, our monitoring center is going to answer in the language that they speak and triage the situation, right? So if it's an emergency and we deem that EMS needs to be dispatched, they're going straight to the home. If it's something that's not emergent, we can triage it and maybe a neighbor or a family member can go over to help. But what it looks like in terms of reporting is we will always follow up with the clients and the family members after an activation. We then send a real-time detailed incident report within 24 hours by email, and that can go to the case manager, to whoever's managing the care team and the care plan, so that everybody's up to date and knows what happens. We'll also include an overview of the incident and any known details about transport, whether that's an admission to the hospital, where, and any information that we can really give that gives them a valuable timeline of events. We really came to this conclusion because we work with a lot of case managers across the country, and we really want to make sure that everybody's fully informed and knows when their clients are in the hospital or even what's going on at the home. So sometimes there really are some things that we can give insight to that helps to create a better care plan for all.